everyone. So in this topic, we will be looking about the pre and paravertebral muscles. Okay, so in order to know where these muscles are, you have to know which is the prevertebral region and which is the paravertebral region. To answer this, we'll take a look at the bones, okay, relevant to this region. So this part till this forms the skull base, okay, the base of the skull, okay, formed by the occipital bone, basilar part of the occipital bone, okay. Just next to that, the bone that is articulating or forming a joint with the skull base is the first cervical vertebra. It is also called as atlas, okay. So this is the first cervical vertebra. Followed by that, we have up to 7 cervical vertebra, 3, 4, 5, 6 and 7. So these cervical vertebra are the bony structures that are present in the neck. Okay, so there are totally 7 cervical vertebra. The next bone that articulates with the 7th cervical vertebra is the thoracic vertebra. How do you differentiate? Because sides there are ribs present. Okay, ribs are seen in the thoracic region, right? So they will articulate with the thoracic vertebra T1, 2 and 3. Okay, and these are the ribs. So this is about the bones that are relevant to this region. The next question is, which is the prevertebral region? Okay, this can be answered very easily. Okay, so all these parts are called as the body of the vertebra. Okay, something is projecting out, no? Leave that for now. Okay, the center region on either side of midline is called as the body of the vertebra. Okay, so the body of cervical vertebra 1 till the thoracic vertebra 2 till T2. Okay, this forms the prevertebral region. Okay, totally there are 4 muscles present in the prevertebral region in the neck. Okay, next we'll see what is paravertebral region. So what does the word para mean? It means parallel. Okay, so it is on the either side of this region. So that is related to these structures. What are these projections? They are called as the transverse process of cervical vertebra. Okay, so the cervical vertebra will produce lateral process that are bifid and that will also have a foramen. Okay, they are called as the transverse process. Behind it will have a spinous process. So this is the spinous process that we are not seeing because we are looking at the anterior view. So what you are seeing is the body region and the 2 transverse process on either side. Okay, so they are the major parts of the cervical vertebra. So the transverse process of C1 till the T1 vertebra forms the paravertebral region. It also includes the upper rib, the first rib as well. So this is the paravertebral region. Totally there are 3 muscles present in this region. In addition to what all muscles are present in pre and paravertebral region, we will also be looking at the initial parts of vertebral artery as well as phrenic nerve. Now, I told you there are foramen on either side, no? That is for the passing of an artery called vertebral artery. Just remember that. That is for the passing of an artery called as vertebral artery. Now, the first muscle that is present in the prevertebral region. Okay, so the prevertebral region consists of 4 muscles in total. The first muscle is called as longus colli cervicis. Okay, so that's the first muscle, longus colli cervicis. Now this muscle itself has 3 parts. Okay, it can be divided into upper oblique part, a middle vertical part and a lower oblique part. So what is present? Now for any muscle, we should be knowing about the origin, insertion, nerve supply and action. So first we'll look at the origin and insertion of each of the part. So the upper oblique part will originate from the anterior tubercle. So I told you the tips are bifid, right? So this is the anterior tubercle and posterior tubercle. Now this muscle is related to the anterior tubercle of C3, 4 and 5. So that is these 3. Okay, it originates there, and where does it insert? Into the anterior arch of atlas. Okay, so this is the origin and insertion of the upper oblique part of longus colli cervicis. The next part that we'll be seeing is the middle vertical part. So the origin and insertion is related to the body of the vertebra. You just have to remember which vertebra it is. Okay. So the middle vertical part originates from the body of C5 to T3. Okay. It originates from the body of C5 to T3, cervical vertebra 5 to the thoracic vertebra 3, and it inserts here, okay, into the body of cervical vertebra C2, 3 and 4. So it originates below C5 to T3 and inserts into C2, 3 and 4. Okay, it is straight line. So that's why it's called as the middle vertical part. The next part is called as the lower oblique part. So that originates from the bodies. Okay, remember all the origin is placed below. Okay, so that originates from the bodies of T1, 2 and 3. The upper 3 thoracic vertebra, and it inserts into the anterior tubercle of transverse process of C7, 6 and C7. Okay, so these are the 3 parts of longest collateral cervicis muscle. What is this muscle? It is one of the prevertebral muscle. So it looks like this. This is the middle vertical part. Okay, now I've added the both oblique part, the upper and the lower oblique part. You also have to remember the nerve supply and action. Regarding the action, just remember this common fact. Okay, let's assume this to be the skull. Okay, and this to be the vertebra that is attached to it. Any muscle that is present in front of the vertebra, okay, in the prevertebral region, when it contracts, it will cause flexion of the neck. Okay, flexion of the neck or cervical vertebra. So that is about the prevertebral. Okay, this is the skull viewed from the lateral view. Now for the anterior view, let this be the skull and the cervical vertebra. If the muscle is situated in the paravertebral region or to the sides, okay, when that contracts, it will cause lateral flexion, tilting to one side, no? It will cause lateral flexion of the neck or cervical vertebra. Okay, so that is about the common thing. Now you can try to guess what the action of this muscle is. Okay, this is present both on the front because it is related to the body, as well as on the side because it is related to the anterior tubercles of transverse process. So it causes flexion as well as lateral flexion. Okay, flexion and lateral flexion of the neck. So that is the action of this muscle. Okay, flexion and lateral flexion. And the nerve supply is ventral rami of C3 to C8. Okay, you have to remember the nerve supply, ventral rami of C3 to C8. The next muscle that we will be seeing in this region is called as longus capitis. Okay, it is called as longus capitis. Now let's take a look at its origin and insertion. It originates, okay, from here. I told you muscles originate at a lower level, caudal level aspect. Okay, from the anterior tubercles of, again, this is 1, 2. So this is C3, C4, 5 and 6. From the anterior tubercles of transverse process of C3, 4, 5 and 6. That's the origin of this muscle. What is the insertion? It inserts into, till this is skull base, right? So it inserts into the inferior aspect of base occiput or the basilar part of the occipital bone. So that is the insertion. Okay, so this is about the origin and insertion of the second muscle in the prevertebral region, that is longus capitis. Okay, so this is how the muscle looks. Okay, and again, nerve supply is the ventral rami of C1 to C3. Okay, ventral rami of C1, C2 and C3. Action because it is situated in the front. Okay, when it contracts, it will cause flexion of the neck. So that is about the action of longus capitis. The next muscle, the third muscle in the prevertebral region is called as rectus capitis anterior. Okay, it is called as rectus because it is a straight muscle, capitis because it is attached to the head region, and anterior because there are two other muscles. Okay, there is also a muscle called as rectus capitis lateralis, which you will be seeing next, and two more muscles in the posterior aspect, which you'll be seeing in the further topics. Okay, they are called as rectus capitis posterior major and rectus capitis posterior minor. So there are totally 4 rectus capitis muscle. In the prevertebral region, we will be seeing only 2 of them, the rectus capitis anterior and rectus capitis lateralis. Okay, so we'll see the origin and insertion of this muscle. It originates from the lateral mass, okay, of C1 vertebra. It originates from the lateral mass of C1 vertebra or atlas, and it inserts into the base occiput. Okay, it originates from the lateral mass and inserts into the base occiput. So this is how it looks. It's a very small muscle. Okay, it is called as rectus capitis anterior, and it's a very tiny muscle. Okay, so the nerve supply is only from the ventral ramus of C1. Just remember ventral ramus for all these muscles in the pre and paravertebral region. Okay, so this is from the C1, and then action, it is present in the front. So when this contracts, it will cause flexion of the neck. Okay, so only for the first muscle we saw lateral flexion in addition. And then the next muscle that you are seeing is, I already told you, the rectus capitis lateralis. Okay, the origin for this muscle is in the transverse process, upper surface of the transverse process of C1 or atlas, and it inserts into the jugular process present in the occipital bone. Okay, so this is the jugular process, and this is how the muscle appears. So this is the rectus capitis lateralis. Nerve supply is from C1 and 2. Okay, so for rectus capitis anterior, it was only C1. For the lateralis, it is C1 and C2, the ventral rami. And the action, it is present on the sides, no? So when this contracts, it causes lateral flexion, tilting towards one side. Okay, so that's the action of the third muscle. Okay, so the first one that we saw was, so again, we'll just take a look at just the names of all the muscle in the prevertebral region. Okay, so this is the first muscle we saw, longus colli cervicis. This is the muscle that causes both flexion as well as lateral flexion. The second and third muscle that we saw were longus capitis and rectus capitis anterior. Both these muscles cause only flexion of the neck, whereas the last muscle that we saw was rectus capitis lateralis, and that muscle causes lateral flexion. Okay, so these are the 4 muscles. Just to remember the nerve supply, the C1 alone for rectus capitis anterior, C1 and 2 for rectus capitis lateralis, 1, 2 and 3 for longus capitis, C3 to C8 for longus colli cervicis. So among these muscles, this one and this one causes lateral flexion, and all these 3 muscle causes flexion of the neck. Okay, so this is about the prevertebral muscles. Okay, so the next we will be seeing about the paravertebral muscles. They are 3 in number. Okay, so in the previous video we saw about the origin, insertion, nerve supply and action of the muscles that are present in the prevertebral region. Now let's focus on the paravertebral region. Okay, so there are totally 3 muscles present here, and they are called as the scalene muscles. Okay, so the first muscle belonging to this group is called as scalenus anterior. Okay, the next muscle is scalenus medius, and the third muscle is called as scalenus posterior. Okay, so what were all the muscles present in the prevertebral region? Longus colli cervicis, then we had the longus capitis, and then 2 rectus capitis, anterior and lateralis. Okay, so first we'll look at the origin and insertion of scalenus anterior muscle. Now remember, this muscle is related to the phrenic nerve. Okay, on the anterior surface of this muscle, the phrenic nerve descends down. Okay, so that's about the scalenus anterior. The origin of this muscle is from the anterior tubercles of cervical vertebra 3, 4, 5 and 6. Okay, so that's the origin. Anterior tubercles of transverse process of cervical vertebra C3, 4, 5 and 6. Okay, and the insertion is into the scalene tubercle. Now remember, the first rib has two grooves present in it. The back one is for the artery and the anterior one is for the vein. Between the two grooves, closely related to the inner border. This is the inner border and this is the outer border and this is the upper surface. Closely related to the inner border, we have the insertion of this first muscle that is called as the scalenus anterior. Okay, so this is how the muscle looks. And the nerve supply is from the ventral rami of C4, 5 and 6. And action is, it causes anterolateral flexion. So this is anterior flexion or just flexion. When it moves to sides, okay, tilting, that is called as lateral flexion. Whereas when it is oblique in between the lateral and anterior, okay, like this, then that is called as the anterolateral flexion. So this muscle causes anterolateral flexion, also assists in rotation as well as it will elevate the first rib. Remember, the scalenus anterior and medius is attached to first rib. Both the muscles will elevate the first rib. The posterior alone is attached to the second rib, so that will elevate the second rib. Okay, so here scalenus anterior elevates the first rib. And then we have the next muscle that is called as the scalenus medius. Okay, so the second muscle in the paravertebral region is called as scalenus medius. Now, origin of this muscle, remember all the tubercles that we saw so far in the prevertebral region as well as scalenus anterior is the anterior tubercle of transverse process. For the scalenus medius and posterior alone, it is the posterior tubercle of transverse process for all these transverse process. C2 to C7. Okay, posterior tubercle of transverse process of C2 to C7. Okay, so for all the prevertebral muscles, the origin was at a lower level. Here it is opposite. Okay, it originates at a higher level and inserts into the first rib only on the superior surface of first rib, just behind the groove for subclavian artery. I told you there are two grooves. The posterior one is for the artery, anterior one is for the vein. Okay, so just behind the groove for the subclavian artery is the insertion of the muscle, the scalenus medius. Okay, and then we have the nerve supply and action. Nerve supply is from the ventral rami of C3 to C8 and action, it is present on the lateral aspect. So when this contracts, it causes lateral flexion and I already told you that it elevates the first rib. Okay, so that's about the origin, insertion, nerve supply and action of scalenus medius. Okay, this is the second muscle that is present in the paravertebral region. The next muscle that we are seeing is called as scalenus posterior. Again, from the posterior tubercles of transverse process of 4, 5 and 6. Okay, that's the origin which is at a higher level and inserts into the outer surface. Only the first rib will have a upper and lower surface. All the other ribs will have inner and outer surface. This muscle inserts into the outer surface of second rib. Okay, so that is the origin and insertion of the second muscle in this region. The third muscle in this region, that is the scalenus posterior. It looks like this. Okay, and the nerve supply is from the ventral rami of C6 to C8. Again, this causes, when it contracts, it causes lateral flexion of the neck region and it elevates the second rib. This is the only muscle that is inserting into the second rib. Okay, so that's about the origin, insertion, nerve supply and action of the three muscles present in the paravertebral region. So here, what are the muscles you can name? This is the rectus capitis lateralis. Okay, this one is the rectus capitis anterior. This is the longus capitis and this one is the longus colli cervicis. Okay, all these four muscles are belonging to the pre means in the front, prevertebral group. Okay, and these are the three muscles that are present on the side. Okay, scalenus anterior, this is the scalenus medius and behind that is the scalenus posterior. These are the three muscles that are present in the paravertebral group. Okay, so this is about the muscles that are present in the pre and paravertebral region. We saw the origin, insertion, nerve supply and action of all of these muscles. Okay, we also saw what prevertebral region means as well as what paravertebral region means. Now we'll take a look at a triangle that is present in this region. Okay, can you tell what this is? This is the outer border of the lower oblique part of the longus colli cervicis. Okay, outer border of the lower oblique part. It had three parts, no, 1, 2 and 3. 1, 2 and 3. Okay, so this is the lower border of the oblique part of the it is the outer border of the lower oblique part of longus colli cervicis. And what is this border? That is the medial border of scalenus anterior. Okay, medial border of scalenus anterior. Okay, what cervical vertebra is this one? That is the 7, C7. Okay, and this is the C6. The next boundary that we'll be seeing is this artery. What is this artery? That is the subclavian artery. Okay, so these are the boundaries of a triangle called as scaleno-vertebral triangle. I'll repeat again. Okay, laterally it is related to the medial border of scalenus anterior. Medially it is related to the outer border of the lower oblique part of longus colli cervicis. Inferiorly it is related to subclavian artery and the apex is at the level of tip of the transverse process of C6. Okay, so that is the apex of this triangle. Now, what are all the contents of this triangle? We already are seeing an artery here. The first branch of subclavian artery, that is this one is the vertebral artery. So that's the first content. The next one is the second branch. Okay, that is called as the thyrocervical trunk. Okay, so first is the vertebral artery. Next is the thyrocervical trunk. We have a branch from this thyrocervical trunk that is present in the triangle. Okay, from this, a branch that is called as inferior thyroid artery. Okay, so these two are branches from subclavian artery and this is a branch of the thyrocervical trunk. In addition to this, there is also sympathetic chain present here. Okay, middle and inferior ganglia will be there, cervical ganglia, and there is a loop formed around the subclavian artery that is called as ansa subclavia. Okay, and sympathetic trunk. So all these are the contents of the triangle, the scaleno-vertebral triangle. Okay, the roof is formed by carotid sheath. Okay, the internal carotid artery, internal jugular vein, so the common carotid artery, internal jugular vein are related here within the carotid sheath. The roof is formed by the carotid sheath, which is a part of deep cervical fascia. Okay, so that's about the scaleno-vertebral triangle. Next, we'll take a look at vertebral artery. Now, what is this vertebral artery? This is the largest and the first branch of subclavian artery. You can see it here. Okay, that is the vertebral artery, and there are 4 parts of this vertebral artery. Remember, the structures inside the skull, the cranium, is supplied by 2 arteries. One is the internal carotid artery that goes in through the carotid canal. The second one is called as the vertebral artery that goes in through foramen magnum. These are the 2 major sources of artery inside the cranium, okay, to supply the brain and the structures related to it, such as the meninges and all. Okay, so this vertebral artery has 4 parts. The first part is related to a triangle. What is a triangle called as? Scaleno-vertebral triangle. So that's the first part of vertebral artery. And second part is related to foramen present in the transverse process of cervical vertebra C6 to C1. Okay, so it enters the foramen in the transverse process. So this is the C7. So from here, okay, when it enters through the transverse process foramen, it ascends up. It goes up till C1. Okay, so that is the second part of vertebral artery. The third part is present in a triangle called as suboccipital triangle. We'll see it in the next coming videos. So the third part of vertebral artery is related to suboccipital triangle. And the last part is after it enters the cranium, the intracranial part. After it enters the foramen magnum, it goes in, that is the fourth part. So there are in total 4 parts for the vertebral artery. The unique feature about this artery is that both the side vertebral artery will join together to form an artery called as basilar artery. Usually arteries will give out branches only, no. Here it will join together. Both the side artery will join together to form a artery called as basilar artery. Okay, and this supplies the structures inside the cranium. Okay, the brain and the covering of it, the meninges and all. It also supplies the spinal cord. Okay, because the vertebral artery gives off the anterior and posterior spinal branches. Okay. So, related to the first and second part that we are seeing here, there are no branches from this artery. Okay. First and second part of vertebral artery, even the third part will not have any branches. So, all the branches from this artery comes from the fourth part or the intracranial part. And then, so this is the first part present in the triangle, the scaleniovertebral triangle, and this is the second part. Okay, you can see it going up. Okay, that is the second part. After it comes out of the foramen, it goes medially to go into the triangle called as suboccipital triangle. Okay, and we are seeing about phrenic nerve. Now this phrenic nerve is the major nerve supply to diaphragm. What is a diaphragm? It is the separating muscle between the thoracic and abdominal cavity. Thoracic cavity has the heart and lungs present in it. The abdominal cavity has all the digestive organs, the stomach, intestines, liver, spleen and all of that. Okay, a separation between this is by the muscle called as diaphragm. This diaphragm helps in respiration. Okay, so that nerve supply is from the phrenic nerve. The root value is C3, C4 and C5. This is very, very, very important. The root value of phrenic nerve. Related to its course, after coming out from the gaps present in the vertebra, okay, it will be related to the outer border of scalenus anterior and the anterior surface. Okay, it will be related to the outer border. It will peek out through the outer border and descend down in the anterior surface of scalenus anterior muscle. Okay, when it goes down, it will pass behind the formation of this vein. What is this vein? It is formed by the union of subclavian vein and internal jugular vein. So this is the brachiocephalic vein. Okay, it will go behind the formation of brachiocephalic vein. Okay, so this is the course of phrenic nerve in the neck region. So what is the root value? C3, C4 and C5. So in addition to the muscles that are present in the pre and paravertebral region, we also saw about the first and second part of vertebral artery, scaleniovertebral triangle, as well as the course of phrenic nerve in the neck region.